Good morning, everyone. I'm Daniel, and I will be presenting the theory of Ida Jean Orlando Falatier. She is an internationally known psychiatric health nurse, theorist, and researcher who developed the deliberative nursing process theories. Her theory allows nurses to create an effective nursing care plan that can also be easily adapted when and if any complication arise with the patient. Ida Jean Orlando Early Life. Born on August 12, 1926, the first generation American born from Italian immigrant parents. In 1951, she married with Robert Pelletier. Her mother's name is Antoinette Orlando. His father's name is Nicholas Orlando. Ida Jean's educational background, being a respectable and credible role model, Orlando was well educated with many advanced nursing degrees. In 1947, she received her nursing diploma from the Flower Fifth Avenue in New York. In 1951, she received her Bachelor of Science degree in Public Health Nursing from St. John University in Brooklyn, New York. And in 1954, Orlando received her Master Awards degree in Mental Health Consultations in Teachers College, Columbia University. Career and experience. During her studies, Orlando worked as a clinical nurse, OB, medical surgical, and mental health. After receiving her master's degree, Orlando went to the Yale University School of Nursing as an associate professor of a mental health and psychiatric nursing. She was awarded a federal grant and became a research associate and principal project investigator at Yale School of Nursing. Orlando eventually became the director of the graduate program in mental health and psychiatric nursing at Yale University, used to propose her conceptual nursing model as the foundation for the program's curriculum. Theory beginnings. Orlando developed her theory from the study she conducted at Yale University. She proposed that patients have their own meanings and interpretations of situations, and therefore, nurses must validate their inference and analysis with patients before concluding. From 1962 to 1972, Orlando served as a clinical nurse consultant at Maclean Hospital in Belmont, Massachusetts. In this position, she studied the interaction of nurses with clients, other nurses, and other staff members, and how these interactions affected the nurses' health to clients. Recorded observation between nurse and patient. In Orlando's study, nurses were given evidence-based reasoning to use your experience and intuition to meet the needs of the patient. Differentiated good and bad nursing. She personally observed over 2,000 nurse-patient interaction and classified this interaction as either good or bad nursing over the course of 3 years. The theory was published in the Dynamic Nurse-Patient Relationship Function, Process, and Principle. In 1961, her book was published. The book emphasized on a nursing professional role, the nurse-patient relationship, and the knowledge development that is distinct to nursing. Orlando's nursing theory stresses the reciprocal relationship between nurse and patient. What the nurse and the patient say and do affects them both. She views nursing professional function as finding out and meeting the patient's immediate need for help. She also described her model as revolving around the following five major interrelated concepts. First, the function of professional nursing, which is finding out and meeting the patient's immediate need for help. Second, presenting behavior of patient. The presenting behavior of patient, which is considered the stimulus causes an automatic internal response in the nurse, which in turn causes a response in the patient. Third, immediate reaction of the nurse. The immediate response reflects how the nurse experiences his or her participation in the nurse-patient relationship. Fourth is nursing process discipline. Investigation into the patient's needs, nurses appropriate actions to resolve the need in cooperation with the patient. Fifth is improvement in patient outcome, the resolution to the patient's situation. The result of his or her action is evaluated to determine whether their actions serve to help the patient communicate his or her need for help and how it was met. Deliberative nursing process theory. In her book, Orlando emphasized the importance of the deliberative nursing process, nursing action, as opposed to the automatic nursing process. Automatic nursing actions are nursing actions decided upon for reasons other than the patient's immediate need, meaning that some automatic activities are ordered by the doctor, others are concerned with routine for caring patient, and still others are concerned with work based on the principles to protecting and fostering the health of people in general. The deliberative nursing action are actions decided upon after ascertaining a need and then meeting this need, meaning nurse-initiated instructions, suggested directions, explanation, information, requests, and questions directly towards the patient, making decisions for the patient and shaping the patient's immediate environment. By Orlando, deliberation is needed to determine whether the activity actually achieves its needed purpose and whether the patient is helped by it. Orlando's second book is The Discipline and Teaching of Nursing Process. In 1972, her book was published, renamed to Deliberative of Nursing Process, as a nursing process discipline and emphasized the needs for every student to receive and special training in the nursing process. The purpose of the training was to change responsiveness as a nurse for one described as a personal and automatic to one that is disciplined and professional. The 5 stages of the nursing process. First is assessment. Second, nursing diagnosis. Third, planning. Fourth, implementation. Fifth, evaluation. The assessment stage, the nurse used the nursing framework to collect both subjective and objective data about the patient. Second is diagnosis stage. Uses the nurse's clinical judgment about the health problem and link to the diagnosis to defining characteristic, related factors, and risk factors found in patient assessment. Planning stage. Address each of the problem identified in the diagnosis. Each problem has given specific goal, and each goal give nursing interventions to help achieve the goal. Fourth, implementation stage. The nurse begins completing the interventions to achieve the desired goal to improve the patient's outcome. Evaluation stage involves analyzing and success and a failure of the current goals in interventions. Evaluating also include examining the needs for changes to care plan. At this point, the nurse will compare the patient from the step 1 all the way to step 5 to determine if the goals have been achieved or not. The goal is, Ida Jean Orlando's goal is to develop a theory of effective nursing practice. The theory explained that the nurse role is to find out and meet the patient's immediate needs for health. According to the theory, all patient behavior can be a cry for help. Through this, the nurse's job is to determine the nature of the patient's distress and provide the help he or she needs. Theory of assumptions. Ida Jean Orlando's model of nursing makes the following assumptions. First is when patients cannot cope with their needs on their own, they become distressed by feelings of helpless. Second, in its professional character, nursing adds to the distress of the patient. Third, patients are unique and individual in how they respond. Fourth, nursing offers mothering and nursing analogous to an adult who mothers and nurtures a child. Fifth, the practice of nursing deals with people, the environment, and health. Sixth, patients need help communicating their needs. They are uncomfortable and ambivalent about their dependency needs. Seven, people can be secretive or explicit about their needs, perceptions, thoughts, and feelings. 8. The nurse-patient situation is dynamic. Actions and reaction are influenced by both the nurse and the patient. 9. People attach meanings to situations and actions that aren't apparent to others. 10. Patients enter into nursing care through medicine. 11. The patient cannot state the nature and meaning of his or her distress without the nurse's help or him or her first having established a helpful relationship with the patient. 12. Any observation shared and observed with patient is immediately helpful in ascertaining and meeting his or her need or finding out that he or she is not in need at that time. The lastly is nurses are concerned with the needs the patient is unable to meet on his or her own. The nursing meta paradigm. For Orlando, person is uses the concept of human as she emphasizes individuality and the dynamic nature of the nurse-patient relationship. For her, humans in need are the focus of the nursing practice. Health. In Orlando's theory, health is replaced by a sense of helplessness as the initiator of a necessity for nursing. She stated that nursing deals with individuals who require help. Environment. Orlando completely disregarded the environment in her theory, only focusing on the patient's immediate need. Chiefly, the relationship and actions between the nurse and the patient, only an individual in her theory, no families or groups were mentioned. The effect that the environment could have on the patient was never mentioned in Orlando's theory. Nursing. Orlando speaks of nursing as unique and independent in its concern for an individual's need for help and immediate situation. The effort to meet the individual's need for help are carried out in an interactive situation and in a disciplined manner that requires proper training. The importance is beneficial in achieving valued outcomes. Research demonstrated that the use of a disciplined professional response enables the nurse to ascertain and meet the client's need. The study of what the client says and does in their practice and the resulting effect is valuable content for nursing education. Mm. Orlando was one of the first nursing leaders to identify and emphasize the element of nursing process and the critical importance of the patient participation in that nursing process. In 1992, she retired and she received the Nursing Living Legend Award by the Massachusetts Registered Nurse Association. On November 28, 2007, Ida Jean Orlando passed away at 81 years of age. This is a research article related to the theory of IDG in Orlando. This study is entitled The Nursing Process, a Tool to Enhance Clinical Care, a theoretical study authored by Hannah Hapoja and was published in the year 2014. To summarize, the aim of this project is to gain deeper knowledge and understanding about the nursing process as a tool of ensuring safety and quality in delivering nursing care. The main questions considering this thesis were: can the nursing process be a tool for enhancing nursing care, and be the nursing process function as a tool to ensure safety in delivering care to the patient? The theory is based on the Ida Jean Orlando's nursing process theory, since Orlando, as well as the Finnish curve classification, uses the term need to describe patient problems. Qualitative content analysis was used to find out whether the nursing process has the probability to lead for a better nursing care. The data was consisted of selected particles that responded find out and that the nursing process has positive effect on both safety and the quality of nursing care by increasing nurses reflective thinking, promoting effective communication, and better quality of documentation. That's all. Thank you.